here with Jane Calhoun this morning from the Leland Medical Clinic, and she's telling us about some of the innovative things they're doing when it comes to healthcare over there. Thanks for coming on.
Oh, you're welcome. It's a great opportunity to let patients know that there is a clinic that has adopted a patient-centered medical home model. Mm-hmm. And what we mean by that is that everything revolves around the patient and the patient's needs, mm-hmm. which means that we are trying to understand that not every patient can come to a clinic between 8 and 5, so we're offering some extended hours on Monday and on Saturday. But not every patient can grasp everything a provider is telling them as far as how to manage their health, how mm-hmm. to manage their disease, in the brief time that the provider can stay with them and talk with them. So we're offering other services like the service of a registered dietitian. Jamesia Thompson is there to work with patients whether they want to lose weight or understand how to control their diabetes or hypertension. Mm-hmm. We also have a community health worker that can also help the patient understand in a layman's terms about their condition. Mm-hmm. Community health workers have been shown to really be able to help a patient who might even need them to make a home visit, to mm-hmm. sit down with them at their kitchen table and explain what the provider has said.
Wow.
So we're using a lot of innovative ways to help patients learn how to manage their health.
Mm-hmm. And is this service, if you walk through the door at Leland Medical Clinic and you need to see a doctor, is this service something that automatically you get to be sort of enrolled in?
Sure. We'll see a patient despite their payer source. We're seeing Medicare, Medicaid patients, mm-hmm. patients with commercial insurance, but also with patients that are uninsured or mm-hmm. underinsured. Mm-hmm. We do have a sliding scale fee at the clinic, which is based on a patient's income, mm-hmm. and it's a big help, even to a patient that has Medicare that might have a limited income. The sliding scale fee can be applied to any out-of-pocket mm-hmm. expenses. So we're really trying to understand the barriers patients have to care, not only time barriers, but income barriers, mm-hmm. Patients that may have a low literacy level mm-hmm. or just difficulty. I know my husband had dyslexia growing up, mm-hmm. so for someone to hand him a handout to say, here, follow these directions, it was just difficult. He had a different way of learning, so we're trying to understand any barriers the patient might have.
Sounds like such a great concept that should be used by more medical clinics. And have you been doing this for a few years, and have you seen results with using this method?
Well, Delta Health Alliance took over operation of the clinic mm-hmm. in April. We had been involved working with other provider clinics trying to help them understand this new model of mm-hmm. primary care. So we did do research at that time and really saw that patients responded well to this approach. Mm-hmm. We did see that they had significant improvements in diabetes and hypertension mm-hmm. by using this approach. Because
those types of diseases, chronic diseases, are really about a lifestyle change. So to have the constant help, it must make such a difference and take sort of the fear out of medical service.
Right, and we understand that those changes don't come easy. It takes a while to make lifestyle changes.
Definitely.
So we accept the patient for where they are and help them make those small changes.
I love that. Well, Jane, I'm so glad that you came on this morning and told us a little bit about this. Also, November is Diabetes Awareness Month, so it's very relevant. And tell us where the Leland Medical Clinic is, so folks at home are interested in going there for their next doctor's visit. Where can they go?
Okay, we're located at 201 Baker Boulevard in Leland. Baker Boulevard runs parallel with 82, so mm-hmm. we're right behind the Sonic on Highway 82.
I know where it is. Well, thank you so much for coming on this morning. A lot of great information. And remember, Leland Medical Clinic, next time you have a cough or something.
Great. We'd love to be your medical home.
Awesome. We'll be right back.